Good afternoon, everyone. Welcome to Asia's Solar Energy for Climate Change Conference, organized by Carbon Care in a Lab, an NGO committed to promoting renewable energy solutions. I'm Alisa Tong from Carbon Care in a Lab, and I will be moderating these sections on solar and health, improving public health and healthcare resilience. Today, we'll explore how solar energy can improve public health outcomes and strengthen healthcare facilities, especially in vulnerable and disaster-prone communities. We are fortunate to have excellent speakers with us. Each speaker will have about 10 minutes for their sharing, followed by a discussion and audience Q&A. As you listen, I invite you to start posting your questions in the Q&A chat box at any time. We'll gather them and come back to them in the Q&A sections later. Without further ado, let's begin. Our first speaker is Mr. Ramon San Pascual, Executive Director of Healthcare Without Harm Southeast Asia, who will bring us the global and policy perspectives. Ramon is a populations, health, and environment policy advocate with many years of experience in civil society organizations working on social development. He has dedicated his career to policy development and advocacy, collaborating with policymakers and stakeholders on populations, health, environment, and sustainable development issues. He has worked with an extensive network of parliamentarian, health professionals, and community leaders to build coalitions that uphold health and social justice in the Philippines and across the Asia Pacific. Ramon, the floor is yours.
Thank you. Good afternoon, everyone. Thank you for making Healthcare Without Harm part of this important forum on solar energy and health. Let me share my slide. I hope this is clearly transmitted to you. Is that okay?
Yes, we can see it.
Okay, thank you. So let me talk about the work that we do in Healthcare Without Harm, where renewable energy, particularly solar, becomes a core to our work in both sustainability, resilience development among hospitals and healthcare systems. Here you would see a very simple illustration of the theory of change that we've been working with as an institution, as global network in Healthcare Without Harm. What we really facilitate is to instill healthy people and healthy planet. First, by working at the basic community of healthcare workers and facilities and their respective cities or towns, and bringing in health and resilience. At the same time, mitigate the impact of adverse impact of healthcare in the environment and now in our climate. So this is both in toxic and greenhouse gas emission. And hopefully by developing those actions, both on the ground and in the bigger society, then we can lead a broader societal transformation that includes healthcare transformation itself in terms of providing healthy healthcare services, but at the same time reinforcing a healthy planet. Now, when I say core, that renewable energy, particularly in the Asian context, solar energy is a core to the agenda on sustainability work in healthcare. You would see here the 10 goals of sustainability being worked out by the thousands of the members of Global Green and Healthy Hospital Network. On top, of course, is leadership, and then at the bottom is purchasing. Now, take apart the leadership, but all these other processes and operations within the healthcare facilities, whether a small clinic or a big public hospital, it centers on the use of energy. So this is why I said at the beginning that energy is at the core of pursuing our sustainability goals and our sustainability agenda. And this is happening not only in Southeast Asia, where I am the executive director for our office, but this is also being done globally, whether in Europe, in the US, in Latin America, in our partners in Australia, in Africa, in India, and in Brazil and other places in the world. So this is really a network of campaigning as well as project and program collaboration that revolve around the community of practice involving 70,000 hospitals and health centers across the globe. And we've been providing many learning tools, as well as guidance documents, as well as actual measurement of how energy is being transformed towards the use of renewables and solar. But energy guidance document is one of those that we released early for more than a decade now to our members in the Global Green and Healthy Hospital Network. Now, energy is a part of the menu in terms of bringing about climate smart healthcare. It is that approach for designing, building, operating, and investing in health systems and facilities that minimizes the emission of greenhouse gas. And that's why the whole energy policy and where do you source your energy is central to the entire discussion on climate smart healthcare. It puts the health system on a climate smart development path and therefore aligning both health development and delivery with that of the global climate goal. And then at the hospital level, this is happening not only through the provision or installation of solar energy, but as well as pursuit of renewable energy and other hybrid forms of energy mix that deliver the goal of becoming climate smart healthcare. Now, this is further reinforced when in 2019, Healthcare Without Harm released a document that that established the extent of the climate footprint of the healthcare as a sector. If it is a country, the whole healthcare sector will be the fifth largest emitting country in the world, constituting 4.4% of global net emissions. And when taken from the three scopes or the sources of emission, energy is contributing at least half of the health sector's carbon footprint. And that's where, again, renewable becomes critical. And to decarbonize the healthcare supply chain and operations is also critical, as it also uses a lot of energy from production, packaging, transport. And at the heart of this, in this paper that you can still download in our website, fossil fuel combustion is the main cause by which healthcare climate footprint is so large, and therefore the solution is to veer away from fossil fuel by going to energy efficiency and renewable. And for that to happen, another 2 years is already during COVID that we released the roadmap for healthcare decarbonization as a global healthcare advocacy institution. We determined that there are pathways by which we can either just stay put as it is for the healthcare sector in terms of decarbonization, or become more creative and bold and decisive in pursuing this roadmap, which is on the next slide, has 3 pathways and 7 high-impact actions. The pathway 1 is clearly to decarbonize healthcare delivery, facilities, and operations. And pathway 2 is again to decarbonize healthcare supply chain. For that to happen, you would see on the right side that the 7 high impact actions on top of it is to power the healthcare with 100% clean renewable energy. This is the imperative now towards zero emission for the healthcare sector, whether it is in terms of buildings and infrastructure, travel, transportation, food, and even the kind of agriculture that will, the system of agriculture that will provide healthy food to our hospitals. This is being discussed and should be pursued as part of the going to zero emission. Now, I hope that clarifies now where, from the macro perspective, renewable energy, particularly solar, do play a role in pursuing a healthy planet and healthy people through health and climate integration. And this is now a specific case study. This is very brief from the Mary Johnston Hospital in the Philippines. And this is almost 2 years ago when they began their solar panel project through a private and hospital partnership. And it is part of their entire sustainability goals that includes a number for their energy, among other things. Now, this is until 2024, the data that is made available to us. But this is still an ongoing and so much more is happening up to the current time. But this, you can already see some numbers up to the April in 2024 in terms of the gross savings out of the solar panel, the carbon emission saved, the equivalent trees planted. And what I want to put emphasis here is the beneficiary of all these savings and advantages of deploying solar panel. It is able to help their particular program on HIV/AIDS and tuberculosis. Just to, and they call it Healing Light. The entire project is Healing Light, meaning it not only provides light or a source of energy, the solar panel, but it provides healing to their patients. So those savings and consumption are put into services to support HIV/AIDS and tuberculosis patients in the hospital. And you would see on the right side again how much money has been added from use of solar panel to providing healthcare services to particular set of clients in the hospital. And Mary Johnston is in an extremely impoverished community in Tondo in Manila. And the population it serves are really among the marginalized. And yet they're modeling the solarization and using the savings towards further services on healthcare. And they want to expand it as they go along and expand the solar panel as well. So the lessons that they have been imparting to us is that financial savings highlight a perspective towards effort at that initiative to cross-subsidize and promote health equity. To us, this is really innovative that we, as even as Healthcare Without Harm or the GGHH network, we never anticipated that it would happen this way. But it is the enlightenment of the leadership that from the beginning they already see the link between decarbonization and healthcare service strengthening. So the challenges, therefore, and I just want to go back how to pursue this in the upcoming years, 3 to 5 years. One, we need to scale up solar energy both in public hospitals and private healthcare facilities. Secondly, we need to integrate solar with the entirety of the energy system in healthcare, including provision to sustainable mobility, meaning making use of the solar energy to run the transportation, including the stop cars and the ambulances within the healthcare premises. And then framing this approach in the larger climate and health work, and that providing the renewable or the sustainable financing that includes both the government and the private sector. There are more that I want to say, but I know we don't have much time, so I stop at this point. Thank you so much.
Thank you, Ramon, for setting the global context and the decarbonization's potential and extended health support in global healthcare sector. We'll be able to come back and then discuss more in the Q&A section and moderation sections. A quick reminder to everyone, please feel free to type your questions in the Q&A chat box. As we go, we will take them up during the discussions. Next, let's hear from Ms. Soumya Vij, consultant in energy, resources and growth at OPM India, who will share lessons from field research and evaluation. Soumya contributes to projects across energy access, clean energy finance, and inclusive development. Her work spans impact in evaluations, monitoring frameworks, and policy analysis, with a focus on social inclusion and gender equity. She currently manages key evaluation, including a study of the IKEA Foundation solar-powered livelihood programs, and has supported research on off-grid solar for health services. Soumya brings experience in energy transitions strategies across emerging markets and has contributed to studies in India and Southeast Asia that explore renewable solutions for underserved community. Let's just welcome Soumya and hear more from her introductions. Over to you, Soumya. Okay, we may have some technical issues, and we lost Soumya, and she'll join back in later. So she's coming in now. Okay, no worries. Perhaps we can move to the next sections first while Soumya is solving the technical issues. Let's just oh great, welcome Soumya.
Thank you so much. So sorry, I was facing some technical glitches.
No worries, no worries. We understand. I just introduced you to the audience. You can start picking up from there to sharing your presentations. Our technicians will help you to present the slide. And if you finish your slide, feel free to give instructions to next slide or something like that. Then our back end will support you with that.
Thank you. Thank you, Dr. Elisa, and thank you, Raymond, for setting the stage for today's panel. And so greetings to everyone joining. And since Raymond has already set up the context for today's discussion, I will move on to further sharing some insights on how solar energy can play a critical role in strengthening our healthcare system and also from a focus on building climate resilience. So Raymond has already stated that how energy is essential for health service, but climate change is disrupting the energy infrastructure. And in my presentation today, I will focus more on the global south and some solutions. And when these solar solutions are designed with resilience in mind, we think that we can ensure the healthcare facilities, they continue to provide the life-saving services. So I'll start, and if we could move on to the next slide. So to begin with, let's just take and just zoom in into why the healthcare facilities are vulnerable to climate change. So according to IPCC, there are risks which can be explained in 3 dimensions. First is like the climate shocks and the stresses, which could come from extreme events such as floods, cyclones, heat waves, droughts, and gradual rise in temperature and rainfall. Second is the exposure of the healthcare facilities. Like, for example, the facilities energy infrastructure is located in an area which is directly affected by these events, the climate events. And at third, we can speak about the vulnerability, like how sensitive the infrastructure is and its adaptive capacity to recover to its original state. So on the right-hand side, you can also see how the impacts, they show up in two ways. So one is that the supply of energy gets disrupted. So either the grid goes down or the on-site systems get damaged. And two is the demand goes up. So the demand for energy increases. Like, for example, the requirement for cooling during heat waves, it increases. And also at times of, if we talk about floods, there is a need for more emergency services and need to power these emergency services. So all of this, what it results into is unmet energy needs, and which can directly impact the healthcare delivery. So on the next slide, I will talk about what is the evidence of these climate impacts on the facilities. So these impacts are not abstract, but we do see them in action. So if we talk about Pakistan, so there were floods in 2022, which damaged or destroyed about 13% of its healthcare facilities. And the reconstruction cost was very high, almost nearly about $188 million. And similarly, there was a case of drought in 2022 in Kenya. And there, as an impact, we saw that the hospital births in Turkana, they dropped from over 400 a month to just 100. And this was partly due to the water and energy shortages. Similarly, again, if we talk about the health heat wave, in Pakistan in 2024, they saw power outages almost stretching to about 16 hours a day. And the health emergency wards were just overwhelmed by the overstretched power outages. And in India also, we saw a cyclone hit in 2019 in one of our states called Odisha, where the hospitals had to rely on diesel generators. Therefore, they had to restrict, or they had to prioritize the emergencies, and they had to prioritize the healthcare service delivery. So all of these examples, they are basically evidence of how fragile the health energy systems can become under climate stress. In the next slide, I'll zoom into more of our challenge in the country, in India, where I'm based in. So if we zoom into India, the scale of challenge is very clear. Almost about 19% of the public healthcare facilities, which accounts for more than 36,000 facilities, are at very high risks of floods. And not only floods, droughts, and also cyclones. So within this, 91% of the primary healthcare facilities are connected to the grid. But even after being connected to the grid, half of them don't have reliable power supply. So the risks, they are always there if in case, and almost impacting 19% of the public health facilities. And the risks, they can vary by different hazards. So for example, the floods and the cyclones, they can damage the generation plant transmission lines. But if we talk about the droughts, they reduce the water which is required for the thermal power plants, therefore cutting supply. And the heat waves, they increase the demand. So the result is that basically the health facilities, they often face both, like disrupted supply and disrupted demand at the same time. So if we move on to the next slide, please. Here, what I want to just pick up very quickly and very briefly are what is the 4 factors if we speak about resilience of any healthcare facilities. So what are the 4 criteria that we should understand? So these are readiness, robustness, resourcefulness, and recovery. And if we just quickly, briefly define all these 4 criteria. So just in time, I just want to quickly define these terms. So readiness means like if a healthcare facility is prepared for shocks and stresses. And robustness is the ability of any healthcare facility to withstand the gradual changes. And resourcefulness is if they are able to continue during these shocks. And recovery, the last criteria that we want to pick up today is what is the ability of a healthcare facility to restore the power as quickly and regain to its original state. So the next graph is a very a quick graph which shows that how we can actually see the pathways to different resilience. So we can see that resilience is like a spectrum. And like if we talk about the worst case where there is no resilience, the energy system basically collapses and the healthcare facilities have to at times shut down completely. In case of low resilience, the system recovers, but not at a very strong state, stays in a weaker state. And with resilience, the facility can bounce back to the pre-event levels. And in the best case, where we talk about high resilience, it can recover stronger than before. So I just want to also place here how solar systems can play a role in the resilience. So they, along with the storage, they can play a central role in at least getting to the third and the fourth stage of resilience, which is with resilience and high resilience. So in the next slide, I've just pointed out some of the ways how the solar can strengthen the healthcare facilities. So there are multiple ways, but if we talk about a few, first, it provides reliable energy for essential services. So that means, of course, the diagnostic equipment like X-ray machines or ultrasound scanners can run without interruption, but also autoclaves and like sterilizers, some of the important equipments can function properly, so that we can effectively control the infections. And perhaps like safe deliveries and emergency surgeries can happen at night with dependable lighting. And if we talk about solar, second is that it can safeguard the cold chains for vaccines and medicines. So solar powered refrigerators, they ensure like life-saving vaccines, blood, and temperature sensitive medicines, they remain viable even in case of extreme heat or extreme outages or long outages. So this is critical when we talk about the climate shocks. And health often needs that spike. And if we talk about digital health systems, so in case if the health facility has reliable electricity, they can still use telemedicine and they can connect patients which are based in the remote areas with specialists, and they can keep the electronic medical records, they can maintain the communication with the district or the referral hospitals. And like very basic, like for example, they can charge their mobile phones for communication and everything becomes more reliable. And it also can translate into patient outcomes. So as I mentioned, there can be deliveries or safe deliveries at night, vaccines can remain effective, and all of the critical treatments, they can continue uninterrupted. So if we speak about why solar, so if we could go on to the next slide, please. So first of all, as we mentioned, like if we have an on-site PV system with batteries, so it ensures continuity in the grid down situations and it powers critical equipment. But if we go beyond that, if we have a microgrid or a mini grid, so it can extend resilience beyond a single facility and they can power communities which alongside the healthcare facilities. So it not only makes the facility strong, but also the surrounding areas more resilient. And if we talk about the off-grid standalone appliances, where we have some solar appliances which are designed to operate on lower voltage, direct current, they are particularly very powerful when it comes to speaking in this regard. So a good example is solar direct drive refrigerators or the SDD refrigerators. And what it can does, it basically freezes water or any other phase change material during the day, and during the night, it can keep the vaccines cool on, and even on the cloudy days, it can keep the vaccines cool. And this technology is being endorsed by certain organizations like WHO and UNICEF. And so switching from conventional refrigerators to solar drive models, they have shown definite benefits like reduced vaccine wastage during power cuts, significant energy savings from the grid consumption, and lower operating costs and maintenance costs. And if I pick up few examples of how solar has basically helped in the resilience, so let me bring out one example from the United States. So in October, there was a widespread spread fire in California, which caused power outages from the centralized grid for approx 14 healthcare facilities, forcing them to either close or restrict the patients. So these facilities, they had to continue urgent care by using expensive backup diesel generators. So what they did was the healthcare provider then decided to introduce microgrids, which was powered by solar energy and large-scale battery systems, and they provided regular additional source of power to this facility and the community as a backup. And picking up some more examples, in Sierra Leone, when the national grid failed for a week, 2 hospitals with solar and storage continued providing critical care. And that experience led them to invest in solar microgrids with batteries as a long-term resilience measure. In India as well, there is an organization called Selco Foundation, which has demonstrated how designing solar for local hazards can help, like for cyclone winds, for floods, and therefore making the healthcare centers far more resilient. So these examples, they prove like solar is not just a climate solution, but also like a health solution. And we can also think of designing the solar for resilience. So if we can go on to the next slide, please. So here we've just pointed out few of the resilience measures, and it does not come obviously automatically. So the design, operation, and maintenance of the solar system matters. So the panels and the batteries should be elevated above the flood levels. They should be securely mounted for high winds and protected with lightning conductors. And storage becomes a very critical element, as batteries, they keep the essential services running during long outages. And what is equally important is regular cleaning and maintenance of these solar panels. And this not only extends the system life, but also helps identify vulnerabilities beyond climate hits. So a well-designed and a well-maintained solar system can actually make a difference between uninterrupted care and total service collapse. So basically, just to conclude, like the entire presentation, I would just like to say that climate change is interrupting healthcare energy systems. And there have been many instances in Global South where I picked up a few examples, but solar energy, it definitely provides a practical and a proven solution to many cases. And it provides, reliable and clean power that can keep the healthcare services running during the crisis. So when we develop or when we design these solar solutions with resilience in mind, we are actually not only strengthening our service deliveries in the healthcare system, but we are also building climate resilience at the same time by reducing the emission and by saving the lives. So that is how I'll end the presentation today. Thank you so much.
Thank you, Soumya, for highlighting how the solar strengthen resilience in healthcare and show us some case study, like to see how, like, which situation we're at. And finally, like, we will turn to Dr. Janmosheva, Program Director and co-founders of Action for LaPoure, who will bring community-level experience from solar health initiatives. Dr. Shaba is a medical doctor and public health professionals with over a decade of experience working in remote and rural communities across LaPoure. At Action for LaPoure, she leads health, education, and WASH initiatives focused on underserved populations. After serving as chief medical doctor, she completed a master's in international public health and recently a fellowship program at the University of Sydney. She brings strong expertise in maternal and child health, project management, rural health systems, and community-led developments. She's passionate about creating inclusive programs that improves access to essential services and drive long-term impacts. Dr. Shaba, the floor is yours.
Thank you, Alisa. So I'll just quickly start sharing. So namaste, everyone. As Alicia has already introduced me, so I won't go in depth about that. But it's really a pleasure to be here to share our Action for Nepal's journey with the Solar for Health initiative. Action for Nepal usually works in, we work in the remote mountainous communities of Nepal. And as Lisa mentioned, we are working in maternal and child health. So when we are working in these remote communities, the realization was that in these remote settlements, the electricity is often unreliable, and they usually, even if they have the grid lines, they have the regular cutoffs, which Soumya clearly mentioned also in her presentation just before. So all those things that she was mentioning there is what we saw in these remote communities. And we realized that solar power was a big game changer if we want to really improve the health service delivery. Our organization's focus was not the solar power, not in the climate change, but then when we were working in maternal child health, this was a big issue. So we saw that in Nepal, nearly 60% of the health facilities in these remote communities have experienced electricity shortages, which are directly affecting the service delivery. So, like already shared by Soumya, all these challenges about the barriers to healthcare caused by not having the reliable energy, like no reliable grid electricity, power outages and all. So I just want to share a small story of the lady on the left, you can see. So this is in one of the very far western remote mountainous community. And here we had started working 3 years back. So when I first went there and I was interacting with this health worker, she's a health worker, skilled birth attendant, auxiliary nurse midwife. And this is in her birthing center. So this birthing center, I don't think if you can imagine, it is in a very remote mountain community, a 2-room building where, if you can see behind her, there is a window which she needs to close because there's no curtains around. So she has to close that window. And when she did that, the room was all dark and they didn't have power supply. And I was asking her, like, so how do you provide this birthing service when a woman comes to deliver? And on top, she's showing me, like, with a torch in one hand, she does the inspection with the other hand. And when the woman is ready, she has the torchlight in her mouth and she's using her hands to do the delivery and do all the processes. So this is how the normal way of how they are providing the service. And for us, it was really very surprising because we had never imagined, because I'm based in the city in Kathmandu, and we feel that there is a need in those communities. And when we go there, we see this reality. And for us, it was like, no, this is not happening. How are they doing the service? Like, what is the quality of service that they are delivering when they are functioning in that kind of circumstances? So then we thought that Solar for Health initiative is something that we really need to think about. And so we thought that it will be a good, reliable energy system, which will be providing the regular power supply so that during those hours when she's doing the delivery, she has enough light to perform better. So that was enhancing the level of care that she's providing. And being from my medical background, I know deliveries often come at night. I was working in a very remote mountain hospital as well before. And yeah, at night, we usually get the deliveries. So for her, it is important that when the emergencies comes, when the deliveries come, she needs to have proper light. And like already mentioned by Soumya, we are also talking about the vaccine preservations and the medications which needs to be preserved at certain temperatures. So that was also supporting that. And more than that, we saw that this will be bringing, this is bringing the confidence in those health workers to perform more efficiently and to serve their communities in a much better way with more confidence, because they have now all the systems in place, all the electricity availability. So with this initiation, we started providing the solar panels and the solar electricity support in the remote mountainous community. So it was how we initiated, and it was to address that gap. And with that, what we saw was like we work in other areas as well. So in WAKU curricula, these are some other areas where we are working, and Bajang is where I was talking about, showing the story before. And in these communities as well, we help them to establish a birthing center. And this is a new birthing center. And if they don't have reliable energy, we are asking, we are encouraging the women to go to the health facilities for deliveries, because in these areas where we are working, there are at times 100% home deliveries. So women are delivering at home and not even coming to the service centers. So we are encouraging, our effort is more on bringing the woman to the health facilities. But then if there's no reliable energy, we are breaking the trust of the women because they don't feel safe even coming to the health center. So for us, it was important. And we could see the transformation of, like, there was improvement in the maternal and child health, like maternal deaths were coming down because they were coming to the health facilities for deliveries. And children were being protected because of the proper storage of the vaccines. And as Soumya also mentioned about the telehealth, we also support telehealth services because one of the realization when we were working in these remote health facilities, just to give a little bit of scenario about how it is in Nepal in these remote areas, like these are the health facilities where there are just 18 months trained health workers. We don't have doctors. Doctors are only in the district hospitals, but these communities that we are supporting is out of the district, quite far, 2 days walk from the district. And here there are the health workers with 18 months training, and people are expecting a medical doctor level treatment. So we saw how difficult it was for these health workers to provide those services. And so we initiated the telehealth program, where we were connecting these health workers with a medical doctor here in Kathmandu. And so in this way, even if they face any confusions for the diagnosis or any needs that they find, then they can call directly to the doctors here in the city and they get those solutions. And it was not only to support the health workers, but also because financial impact of the unnecessary referrals, because when they are sent to bigger centers, it is because they are not confident of what the diagnosis is. So they were sending those patients to the higher centers. So there were often unnecessary referrals. So we had to set up a lab service as well, because a doctor cannot do a lot without the lab results that they can see. And so in this way, we've set up the lab, and we saw that even for the lab functionality, it was important that they had regular power supply. And so this has also improved. And we know for telecommunication, we need the mobile phones to be charged. So this also worked in that area. And so the health workers are now more motivated, and the communities are now trusting these health facilities. So we saw this transformation of how this we were not thinking about all those things when we were, there was some underlying things that we were thinking when we were providing that support, but the impact that it made was really amazing. And like I said, with this, it was not only supporting the health facility, but it was supporting the public health area in those communities. Like we were providing the access by providing clean energy availabilities in those communities. The people are now going to the health service center to get care, and that is where the life-saving interventions are happening. So we are providing the equity thing. So we are providing the equal service, not only in the urban areas, but they're also receiving this somewhat similar kind of service in those remote communities where often the services are very poor. So it is also working in the line of equity and improving the quality of the health service. Like I said, if it was to be provided in a dark room with a torchlight in the mouth, you can imagine the service quality in that situation. And when you are in a properly lit room where you can have all those access to the medicines and equipments and supports, the ultrasonography machine that you can use. So this was improving the quality. And as Ramona also highlighted about the SDG alignment and the resilience that we are talking about since the very beginning of the talk this morning. So overall, it has a big impact on the public health side. So just sharing a bit of the pictures, like you see, this one is a hospital in the mountain community where they are now able to use the ultrasonography machine. They have this X-ray machine, which they are able to use because often these patients are coming walking for hours. And if they come there and there's no electricity and the person says that, no, we cannot do anything because we don't have electricity, why would they even bother to come next time? So we really, I think, we saw this change of why people are coming. And you can see one of the birthing centers where we had supported with the building as well as the solar panels. So a well-lit birthing center where people feel comfortable coming in and doing the deliveries. So this has been the initiative of Action for Nepal. And because we are also working in education, so we also have supported the schools. And in these remote areas, there are the boarding facilities because children often have to walk for 6 or 7 hours to reach the school. So they also have the boarding facilities where if they are properly lit, it is also the protection issue. There's also the other areas which we are supporting. So this is one of the remote villages, the school in that part. So to conclude, I would say that in villages like in Waku, Karikula, and Bajang, solar power has turned the lights back on for the healthcare. And so the lesson is quite clear. We want equitable, resilient, and sustainable healthcare. So renewable energy must be a part of the solution. And that is what now Action for Nepal is carrying forward. So we, when we are supporting the infrastructure support in these remote communities, now it has been mandatory to also include the solar power support because it is, I think, also the local government now has taken this initiative and they know the importance of it. It does not only have the impact on saving the lives of the people, but overall it has a bigger impact. So it is now our motto and we are working towards it. And you can see the differences that has been made so far in the communities. So I'd like to end with this. Thank you so much.
Thank you, Dr. Sherba, for the inspiring perspective from the community levels work. And it's also encouraging to know that like all this like case study pilot can inspire the government to take further actions to scale up the support. And we now will move into the discussion sections. Like audience, keep the questions coming in the chat, and we'll pick them up shortly. I'm combining like moderator-led discussions and the Q&A together concerning with the time. But like being a moderator, so I'm like have the privilege to ask the first questions. Like thanks for all speakers to bring up like this important and critical like topic for like how solar can solving the healthcare system risk when extreme weather events happen. And it made me feel like we should put all the major resources to ensure our system work when crises come. So when like I'm hearing three of your presentations, I'm curious, like from your experience, like in all three countries, what is the single most important factors you think, like for scaling up the solar in healthcare facilities, whether it's about policy, financing, community engagement, or any other factors that we may overlook? Whoever like feel comfortable, like you can come in and take the questions.
Yeah, for us in healthcare without harm, the most important factor here to scale up is really the awareness and the decisiveness of hospital leaders to move forward to solar and other forms of renewable energy. As we've been organizing healthcare facilities into a global network on the platform of sustainability, we always notice that in order of issues that they would tackle, they would raise healthcare waste, One, they would also raise energy and perhaps food or water at the next set of sustainability goals they want to pursue. But unlike in waste management, the hesitation to move forward with renewable is one on the cost, and then second on the viability, long-term economic viability. In third, in terms of operations, who will be responsible to be in charge of maintenance and ensuring that the solar remains efficient for as many years that it would run. So, in as much as it's a policy question, there is also the need to further educate and show good cases where hospitals, particularly public hospitals, where there is so much complications of putting renewables onto their roof, to encourage them and take the bold step to just do it. In many instances of those who have done it, these are really the enlightened leaders who, despite having no funds at the moment, the viability issue, the long-term management of it, still would go forward simply because they know the big picture. So I think that's the first key to the scaling up. Thank you.
I think I'd agree with Ramona, because in the community level where we are working, I think this is a very beginning stage. It is the orientation stage where they need to know about it, because the lack of knowledge about the existence of such things is, I think we really have to start from there in those communities where we are working. And if people are aware of it, then only they will see, they will be able to see the good examples of the things happening across the world. And so that's how they will be learning. And having said that, I think it is also important for the communities to take the ownership. The leaders in those communities, they really need to have to take the ownership. And it's not just because somebody thinks it is good that they take on it, because in the long run, if they are not taking the ownership, we cannot do a lot. So policies where they have to include these areas is very important. Thank you.
Yeah, and if I could also come in, I agree with both of them, and I think most of the factors have already been stated. But in addition to that, I would just say that it's more like for scaling, we need the entire ecosystem to work together. So, the policy is already in favor of, increasing the renewables here, if I speak from a perspective of India. But what we really need is, to have evidence of the impact. So basically bringing in the exposure to some of the very remote healthcare facilities to actually prove it to them that, how it's been a game-changing situation for some of the health facilities who've already been taken the decentralized renewable energy in their energy infrastructure and integrated it. And also the maintenance. So in some of the cases that we've seen is that in most of these cases, what happens is after a couple of years, when if they're not maintaining the systems properly, they will see a wear and tear in these panels, and at times the efficiency goes down. So they don't have that network of technicians which is close by, and at times they're not even aware who should be the technician that they should contact in terms of, if there's any repair work needed in the panel, or if there's anything related to the efficiency when it comes to the inverters. So yeah, so I think maintenance and creating that network of technicians is very important when it comes to scale.
Thank you, Stu, for sharing. There's a queue of Q&A, so I better start jumping in the questions. We received a question from Sean York. What's finance, procurement, and operation and management O&M models can unlock the next wave of health sector solarizations while ensuring long-term reliability in India, Nepal, and across Asia. Anyone would like to take this question?
I think I can go ahead if the others want to take some time, and then maybe for not for all, but maybe I can pick up some financial models that we have seen working in some cases. So I think some cases that we've seen really working well in Asia is what we call as blended finance. So like it's a combination of loans plus donor grants, etc. So there's different organizations like World Bank, and there's a energy program called Sustainable Energy for All, which are actually looking in solarizing these healthcare facilities. So what they do is they actually reduce the subsidy upfront costs, and the private players, they invest and they recover through the service fees. So that is one of them. And if we talk about the O&M model, one could be where energy comes in as a service. So it's not the healthcare facility who has to maintain the system, but the vendor who is installing the solar systems, they actually own, they operate, and they maintain the system. And this healthcare facility, it just pays for the energy that they use from the system. So that could be one model. So energy as a service.
Dr. Lisa, there is a question directed to me, if I may answer it, particularly the one from Gigi Lam. Is that all right?
Yeah, sure. Maybe we take these questions and then we need to wrap up our section. So Gigi Lam asked about how can decarbonization pathway and solarizations, Ramon designate for healthcare sector translate into standardized health first solar design criteria that India, Nepal, and other Asia's countries can adopt to make decarbonization measurably improve access, quality, equity, and resilience. Could you share your thoughts?
Yeah, the way we approach it, thank you, Gigi, for the question, is that those hospitals that are ready to adopt and would take the plunge into a solar and renewable future of their hospitals, we make sure that they are provided with the tools and are trained to utilize the tools. One, to measure carbon footprint in the hospitals and be able to register even on a monthly basis the data that is made available, whether because of there is that monthly billing that comes in, and then break it down into sources of where the energy consumption is happening, whether it is on waste management, whether it is on operations of certain equipment, or direct importation from the grid just to provide the light and the cooling or the air conditioning. These are important bases to actualize and see with your own eyes how reduction is happening month to month because the leadership of the hospital decided to invest in solar panels. Now, this is important because it translates to cost and savings right away. In a typical hospital that we have helped install solar panels, on the first month outright, there is immediately an actual savings of 10 to 15% on their energy consumption. So that is actual money that they can now decide where to divert, whether to further their healthcare facilities, to improve the welfare and the benefits of their healthcare workers, or to invest further in solarization into the future. But this 10 to 15% is concrete savings that provide impetus to further manage their solar energy. And the tool is also a way of measuring carbon emission reduction. Not only translated to cost or savings, but also translated in terms of healthcare provision and healthcare outcome that such lower emission is translated into. And third, because now you can monitor both your carbon emission reduction and your consumption reduction, then you plan out better in terms of scaling up, whether to the nearby hospital if you are in a healthcare system, or to the next public hospital if you are under the Ministry of Health. But such active modeling provided with the data coming from that tool that is online and managed by people who are simply looking into their laptop and into their cell phone, then the system-wide transformation hopefully happens sooner than later. So that's where that health first solar design criteria is taking place. And all of these have their health outcome implications. Thank you so much.
Thank you, Ramon. I really love our discussion to carry on, and we still have some questions in the Q&A sections that addressing like to Dr. Shapar in Nepal or Soumya in India. If you have time, like feel free to type the answers on the section so that like this or after the sections you can connect with the speakers as well. And as we wrap up, a really big thank yous to our speakers today. And also for all who attend and joining our discussion today. I look forward to like our continuous collaboration in advancing the solar solutions for healthier and more resilient communities. And we hope to see you again in ASAC 2026 next year. And until then, take care and goodbye.
Thank you so much.
Thank you.